I still walk out of the room after doing this procedure and say to myself, did we really just do this? You know, in a 91-year-old who was dying of class 4 heart failure. This was not on anybody's radar screen 3 to 4 years ago.
Transcatheter aortic valve replacement, or TAVR, is what doctors call a breakthrough procedure, giving patients with severe aortic stenosis, which is the narrowing of the heart valves, a life-saving option.
You know, percutaneous aortic valve replacement means implanting a heart valve via several routes, whether it's through the groin, the tip of the heart, or the apex, or through the aorta. And it's avoiding a traditional manner of replacing an aortic valve, which is via an opening of the chest.
Patients who are candidates for this minimally invasive procedure are deemed extremely high risk or inoperable, often due to age or other complications.
A good majority of the patients that we have done over the past 2 years probably would have been patients who would have been sent to hospice and likely would not be alive today if it were not for the advances of this procedure.
Once you get symptoms from aortic stenosis, 90% of patients are dead within 5 years. And if you have congestive heart failure, 50% are dead within 2 years. So it's a lethal condition to be diagnosed with.
It was almost a year ago when 91-year-old Jean Podolsky underwent the TAVR procedure.
But they told me if I didn't have it, within a year, something drastic was going to happen.
As of several years ago, a patient like Jean with severe aortic stenosis would have no options. But after the procedure, she says she is more active and feels 20 years younger.
I don't have a walker, I don't have a cane, I don't have to go in a scooter. I can do most anything I want.
Doctors at Sarasota Memorial say transcatheter aortic valve replacement can improve a patient's quality of life and even extend it.
This is the 100th case. We've been doing it for just over 2 years, and our volumes have been increasing, and we've been having excellent outcomes compared to national average and to medical centers that have been doing this for a little bit longer than we have. And since we've been able to keep up to them, and our results are in some cases, in many cases, better, it's exciting. It's a nice goal that we've accomplished, and we're anticipating it to continue to increase in the area.
These are people you expected, 3 years ago to never see again after an original office visit. And when you see a 91-year-old, driving to the office independently, 2 years after a remarkable procedure, I think you know you're part of something special.
For Sarasota Memorial Hospital, I'm Shannon Welling.